After all this surgery, yeah, I think you should move this side. Come this side. There are not many people, no? This is even better, I think. Anita, you can come that side. Huh? Please come that side. Not many people here. So the fact is that there is absolutely no post-operative edema seen. Now, can you guess why? Can you tell me why? Yes. So you have heard of the RAP phenomenon. I know you are familiar with this. Have you heard of the RAP phenomenon? So the RAP phenomenon is completely eliminated, more or less. So what happens? The post-operative edema, the inflammation is very low. And the other point is, because the bicortical screw fluids are very favorable, it allows drainage. You understand? The design is such. Now, where's the board? Whiteboard? Yeah, the shaft is very narrow. Shaft is narrow, and the fluids are they are wide pitched. So what happens? Whatever inflammation collects, it drains out. So it creates a pathway for the drainage. You understand? So therefore, what is the advantage? In post-extraction sockets, it works very well. Even in the presence of infection. Good morning. Even in the presence of infection, it works very well. Why? Because it allows drainage. That's why when you've done a cyst enucleation, you can insert a bicortical screw easily without any problem. Yeah, immediate, of course. Yeah, you can. The only thing is, you have to engage the basal cortical bone, number one. Number two, cure it thoroughly and try to remove all the infection. You understand? So that is the classic feature of bicortical screw. And the other thing is, please remember, the anchorage is only in the cortical. All the rest is it's just giving an extended support, that's all. And over a period of time, initially you have osteofixation, and after a year, you can expect osseointegration to take place. Now, how many of you, are any of you oral surgeons? He is an oral surgeon. Well, okay, you're also an oral surgeon. Now, all oral surgeons would have noticed that when you've done plating, let's assume you've given a titanium plate with titanium screws. Within 6 months to 1 year, you see bone growing over it. Yeah? So now, these plates and screws are smooth surface. So something similar happens here. So you get osseointegration. The only difference is osseointegration happens a little late because you don't have that rough surface here. No. You can just leave it. Now, see, I adopt a technique. What I do, sometimes, the pterygoids are unfavorably positioned, and sometimes it might hurt the tongue. So I have a technique. What I do, I just adapt a little bit of rubber-based putty over that. It acts as a protective covering. That's what I do. Yeah, just leave it. Just create a small, a very thin horseshoe-shaped putty. You just apply over the implants and leave it. It'll set and it'll protect. There's no problem. Of course. See, No, it will not come out easily because it is locked against the implant heads. You understand? It's locked against the implant head, so it will not come off. No, that's why I said you protect it with a putty barrier. So that will help. Copac will help, but then what is the need? There's no need. Copac has got to be left in place for a certain amount of time. Only then will it help. Now that's not necessary. Yeah, putty is good enough. What is the stage now? It's going on? Just. Okay. He's already tried the insertion. Okay. Any questions on that? Okay, the metal trial is over. Huh? See, there is another video before this. You have in BCSA N